multiple sclerosis can be a very disabling illness, but in some cases it's surprisingly mild, even after decades of disease. For instance, I have one patient who had optic neuritis at age 30, but didn't have her second symptom of MS until her mid-60s, essentially having a 30-plus year remission. Another one of my patients with primary progressive MS, also in her 60s, was able to work full-time and even complete a 50-mile walk. Today, we'll take a look at this concept of benign multiple sclerosis. I'll show you some evidence that on the average, at least, MS is becoming less severe and less disabling. And I'll show some evidence for this concept that some people have very mild or even asymptomatic disease. I'll show you who's more likely to have benign MS and some clinical and also biomarker predictors. And finally, I'll end with some critiques of the concept of benign multiple sclerosis and the skepticism of this idea. Remember what Kobe Bryant said: "No matter how difficult the challenge is, always stay positive and believe in yourself." Throughout this video, I'll refer to the scale called the Expanded Disability Status Scale used in multiple sclerosis research as a measure of disability. It's a 0 to 10 scale where 0 is no disability, less than 3 is mild disability, 3.5 to 5.5 is moderate disability, and at EDSS 6, a cane is required to walk 100 meters. For more technical details, please click the link in the description below. If you look at historical natural history studies of MS, the prognosis wasn't so great, with a significant number of individuals developing major disability. This is a study between 1968 and 1983, prior to the advent of disease-modifying therapy. The first DMT beta-seron was FDA approved in 1993. And you can see on the left side is their disability status score in 1968, and on top, the same individuals, their DSS in 1983. And you can see, if you look at the individuals who had lower disability from 0 to 5, most of them developed an EDSS of 6 or greater by 1983. So after 15 years, even if they were doing well at the beginning, a lot of them had significant mobility problems. However, if you look at modern studies, the prognosis seems to be better. For instance, this is the MS EPIC study published in 2016 from the University of California, San Francisco. Now, this is people who had relapsing onset MS. So we're not exactly comparing apples to apples, because people with progressive onset MS tend to do worse. However, this data looks very favorable. This is time to EDSS 6. In other words, the proportion who do not need a cane. So it starts off at 100% and then goes down slowly over time. However, after 10 years, only 4.7% needed a cane, and after 20 years, only 16.2%. Now, if you look at the end of the chart, by 40 years, most people do need a cane, but these individuals are significantly older. Another way to look at this is time to secondary progressive MS. So you start off with relapsing remitting MS. How many develop slow progression? Keep in mind, it's hard to define exactly when this transition occurs, but they found that after 10 years, only 6.4% had progressive MS, but by 20 years, it was 24.2%. So still, even after 20 years of disease, most people don't have progressive MS if they start off with relapsing MS. This is a study from Sweden looking at the probability of different levels of disability in 2010 compared to 1995. So we're looking at the probability of reaching EDSS 3, 4, or 6.0. And here you're looking at the relative risk, where less than 1 means a lower probability in 2010 compared to 1995. And you can see the rate is less than 1, 0.95, 0.93, 0.92 for EDSS 3, 4, and 6 respectively. Now, these aren't huge differences, but this is only a 15-year period. Keep in mind, over a larger period, like a 50-year period, there would be a very significant difference. They also looked at people who started on disease-modifying therapy early or late in their disease, and there was a slight trend to people starting early treatment having a lower probability of reaching each level of disability. There are also reports of people who are diagnosed with multiple sclerosis at autopsy, even though they didn't have symptoms of MS during their life. Now, this is a misnomer because part of the diagnostic criteria of MS requires that you have symptoms, but take a look at this. This is a case series of 5 5 autopsies where people had lesions that look like MS, even though apparently there was no history. I found another case series of 2 cases of autopsies showing unexpected, clinically silent multiple sclerosis. This is an example of what these autopsy findings might look like. You can see these subcortical white matter sclerotic plaques. This is not from the article. They didn't have the pictures, but it just shows the idea that you could be walking around with these plaques, but maybe the damage is not severe enough to cause symptoms. There are also studies on identical twins that are quite illuminating. For instance, this study on identical twins found that if one twin has MS, the risk in the other twin who is genetically identical is 30.8%. Very high because MS is to some extent genetic. However, sometimes the other twin has an MRI that looks like MS, but they report no symptoms. There's also this phenomenon of radiologically isolated syndrome, where someone has an MRI for another reason, like headaches or head trauma, and it shows lesions that look like MS, but their person has no symptoms. Some of those individuals go on to develop MS, but some do not, and it opens up this possibility of a very mild asymptomatic form of the disease. But how exactly do you define benign MS anyway? It sounds like a subjective idea, and for older authors it was. According to one source, benign MS is when after 10 years the individual is, quote, without restriction of activity for normal employment and domestic life, but not necessarily symptom-free. According to another source, it's the ability to work after 20 years. According to yet another source, it's slight disability after at least 10 years. Another source says fully functional, whatever that means, after 15 years from onset of disease, but more modern definitions usually use a cutoff in terms of the EDSS scale I described earlier, such as after 15 years of disease, the EDSS has to be less than or equal to 3, and this is the most common cutoff I found. Another source said EDSS of 0 to 2 after 10 to 15 years, which would be about 20% of people with MS, according to a publication in 1977, although 2 or less would be a very low EDSS scale, because a lot of people who have an EDSS of 2.5, 3, or 3.5 are doing extremely well. In my opinion, these aren't necessarily great definitions because time from disease onset isn't actually the best predictor of disability. It turns out that absolute age, time from birth, is a greater predictor that correlates more strongly with disability. People who get MS later tend to become disabled more quickly, and it's just a general tendency that older people with MS are on average doing worse, whereas 20-year-olds with the disease tend to be doing quite well, at least on the average. And there's a lot of research on predictors of so-called benign MS. For instance, the following are predictors of a better prognosis. One would be the symptoms. It's better to have optic neuritis, pain and vision loss in one eye, or other visual symptoms or numbness, rather than motor symptoms such as weakness, sphincter symptoms like urinary incontinence, or cerebellar symptoms or other brainstem symptoms such as clumsiness. It's better to have a relapsing onset than a progressive onset, and on the average, people who are younger when they get MS become more disabled slowly. However, this is misleading because, as I said, it's absolute age that is more correlated with disability. If you're 20 years old, you're very unlikely to be seriously disabled at age 30 if you have relapsing onset MS, but you might be more concerned about what things will look like at age 60, and there it may be a different story. Recovering from the first attack is a good sign rather than having significant residual disability, and a long gap between the first and second attack, in other words, having less relapses, is a good sign. And low disability begets future low disability. For instance, if you have low disability at your first attack or within the first 5 years, you're more likely to be doing well at 10 years and 20 years, and the same thing with age. If you're doing well at age 40, you're more likely to be doing well at age 60, because we think early injury to the nervous system in relapsing MS may set up the nervous system for degenerative decline with natural aging. There was one study on veterans that found that those who had an EDSS less than 3 in the first 5 years had a low risk, only 11%, of getting to EDSS 6, again that's walking with a cane, at year 15. There's also some evidence that men do slightly worse than women on average. This is a study looking at benign MS, EDSS of less than or equal to 3, and you can see at year 15, slightly over half met that criteria, and it slowly went down, and you can see the line is a little bit higher for females than males, although this effect, in my opinion, is greatly overstated, and there's a tremendous amount of individual variation. Also, there could be a bias where a lot of men with mild symptoms are undiagnosed because people think of MS as a female disease, so I'm not sure this is even a real biological phenomenon. There is some correlation between brain MRI lesion burden and the rate of disability. For instance, this study compares aggressive MS in yellow versus benign MS in blue, and you can see total brain white matter lesion volume in the x-axis. The y-axis is just total brain volume, and there is some clustering of the blue dots on the left side, less white matter lesions, but some people have a significant amount of lesion burden but still have benign MS. After all, a lot of lesions which look bright on T2 MRI sequences are remyelinated and functioning well. This is statistically significant, but it's hugely overlapping, and we just can't tell how much tissue damage there is just from a T2 bright lesion on MRI. People have also looked for biomarkers that correlate with benign or aggressive disease. This is from a study from Brazil looking at myelin basic protein, which is a protein in myelin which can be elevated during a multiple sclerosis attack or even during remission, and they found the absence of elevation of MBP during remission correlates with more benign disease, suggesting that there's less central nervous system injury. They looked at other things like visual evoked potentials, spinal tap results, and peripheral T cell markers, and they found absolutely no association with benign disease, although I would say the overall evidence does suggest that people with oligoglonal bands likely are more likely to have aggressive disease than the small number of people, about 10% of people with MS, who do not have oligoclonal bands unique to the cerebrospinal fluid on spinal tap. I do have a separate video on that exact topic in the links below. They also have looked at serum neurofilament more modernly. This is another marker that can be measured in the blood, neurofilament light chain, a marker of central nervous system injury. It's very nonspecific, can be elevated in various neurological diseases, but higher levels do suggest there's more damage occurring, and there is a slight correlation with serum neurofilament light chain and people who have progression of disability. You can see the p-value of 0.031, which is statistically significant, but there's a huge overlap, and I have to say overall it's just not very predictive and not very clinically useful in my opinion. And you may be wondering, how common is benign MS? Well, it depends on what study you look at. It could be as low as 5% or as high as 40%, depending on the exact cutoff and how old the participants are and how long they've had multiple sclerosis. You may have noticed that aside from the 2016 MS EPIC study, almost all of these studies are somewhat older, and that's because this concept of benign MS is very controversial and highly criticized, and you don't see this term as often anymore. The thing is that when we measure disability, we're really just looking at one point in time, and benign now does not always mean benign later, as I'll show in the next several slides. Also, the EDSS isn't really a great measure of disability because it leaves out invisible but important and often disabling symptoms like cognitive impairment, which just isn't captured well with the EDSS. Same with fatigue, which is actually the most disabling symptom for most people with multiple sclerosis. Also, people who believe themselves to have benign MS may decline treatment, which could be beneficial and prevent them from getting worse years or decades down the line. This is one example of a study where people with benign MS were followed over time, in this case for 10 years between 1986 and 1996. First, we'll look at the baseline data, looking at the 36 individuals with benign MS versus the 145 with non-benign MS. You can see that women were slightly overrepresented, 80.6% of the subjects versus only 19.4% men. You can see they were 45 years old, and herein lies the problem. It's hard to say that someone has benign MS at age 45. You just have a lot of years to live. But their age of onset was around 25, so they had MS for around 20 years, and their mean EDSS was 1.9. So they were doing very well. That's quite a low number, and 67% were employed employed, and of course many could be unemployed for reasons that have nothing to do with MS, and only the minority required any form of external support. But what if we look at them 10 years later in 1996? Now we're comparing 1986 on the left to 1996 on the right, and we started with 36 individuals, now it's 28, so we lost 8 subjects, and there could be some bias. I presume people with benign MS tend to be more likely not to follow up, but you can see things have changed a lot. Now it's 75% women, about the same as the general population of people with MS. You can see they're 57 years old on average, so they're a little bit older than if they had just aged 10 years, and their age of onset has also risen, so they've had MS for on average 30 years, but the EDSS has skyrocketed from 1.9 very mild disability to 4.6 and a median of 5 moderate disability with significant walking limitation. The percentage of people with a pyramidal functional system score greater than 3, meaning some degree of significant weakness, has again skyrocketed from 2.8% to 64.3%, and only 21.4% are now fully employed, and the majority receive some form of external support. And now 53.6% of these individuals with so-called benign MS are now in a progressive phase. So again, benign MS now doesn't necessarily mean it's benign long term. This is another study with a similar result. They looked at people and they divided them into either benign MS, EDSS of less than or equal to 3, or non-benign, in other words, 3.5 or higher. And you can see they looked at people who had an EDSS less than or equal to 3 at year 10. And the people who already did not achieve that, in other words, they were already greater than 3 at year 10, they're the red line, and a lot of them did acquire significant disability. If they followed up for 30 years, you can see their mean EDSS is around 6, in other words, requiring a cane to walk 100 meters. And you can see people go from benign to non-benign at various points, 10 to 15 years, 15 to 20 years, etc. Some people do stay less than 3 the whole time, but it's only 26%, a meaningful percentage, but not the majority. You could say after 30 years, 26%, that's not too bad. That being said, when I posted this on Twitter, Judy Graham, who's the author of Managing Multiple Sclerosis Naturally, said it's after 30 years that people with MS need to worry about. In other words, she's saying 30 years is not enough. She says, I had benign MS for 30 years, then it turned nasty, and she reports after publishing this book that she did develop a progressive MS and a significant amount of mobility problems. Now, it's hard to verify that people are real online, but just take my word for it. From the nature of the post, this probably is the real Judy Graham. And even if the EDS is low, there's still those invisible symptoms. This is a study on 125 people with so-called benign MS, mean EDSS of 2.8, pretty low, mean disease duration of 24 years, average age of 51. So these are middle-aged people who have had MS for a long time, and 42% never took disease-modifying therapy. But were they really benign? 29% could not walk more than 1,000 meters. That's less than a mile. Cognitive impairment, defined as 1.65 standard deviations below average in more than 20% of cognitive tests administered, was 8%, a small minority but not trivial. Fatigue in 73% and depression in 46%, so benign doesn't mean symptom-free. This is yet another study on benign MS. They used a cutoff of EDSS less than or equal to 3 for people who had the disease for more than 15 years, and 45% had cognitive impairment and 49% had significant fatigue. This study focused purely on cognitive performance in so-called benign MS. They used a variety of cognitive tests, and you can see the percentage of people who scored below the norm on varying tests. It was definitely the minority, but not a trivial number. And again, a lot of people look good with MS, but they're unemployed or underemployed or otherwise not living their best life due to subtle problems like fatigue, fatigue and difficulty multitasking. And so I'll end the video by giving my personal opinion. I do think benign MS is real. I think there are some people who do so well for so long at such advanced ages that we might be doing them a disservice by even diagnosing them and causing them unnecessary stress. And for some people, the risks of the treatments may be greater than the benefits. The rub is that it's really impossible to identify people in advance. I don't think that I could tell a 30-year-old you're going to have benign MS. Hey, if I have a patient who had optic neuritis and they've had MS for 20 years and they're now in their 50s and they have no complaints and no disability and no cognitive impairment and their MRI scans look great with relatively few lesions and no atrophy, I could say, you look great, you're doing well. On the average, you would certainly do better than the average person with MS, but I simply cannot predict the future with 100% accuracy. And unfortunately, there are some people who do well for many decades and later do develop progressive multiple sclerosis. In terms of the definition of benign MS, I'm very hard-pressed to give a definition, but I think it should involve having a low disability at a high absolute age, like age 60 or 65 or 55 perhaps, not duration of disease, because again, it's really absolute age that correlates more strongly with disability, and I think it's more important to the individual in terms of lifestyle. You really don't want to be disabled at age 40. Of course, you don't want to be disabled at age 70, but it's definitely somewhat less bad. You had a chance to have a career and have a family. If anything, you would want to have more disability later on and live the majority of your life with minimal symptoms. I'd be interested to know, does anyone who's watching this have benign MS? How old are you? How long have you had MS? What are your symptoms? What is your lifestyle like? What medications have you taken? I'm actually doing a research project looking at people with MS who are over age 55 to see if there's some sort of correlation between lifestyle and disability, like diet, sunlight exposure, vitamin supplements, exercise, smoking, and see if we can give any evidence-based advice to people, at least based on observational studies. And let me know if you have any suggestions for future videos.